Eliot stares at the hospital forms, realizing the CEO who needs his kidney is demanding he sign away his right to speak about it. If you've ever felt powerless against those who hold all the cards, hit like and subscribe. The papers trembled in Eliot Hayes' calloused hands as he sat in the sterile waiting room of Chicago General Hospital. Fluorescent lights buzzed overhead, casting everything in harsh white glare. At 38, he'd grown accustomed to life's cruel jokes, but this felt different, bigger, more dangerous. Dr. Martinez had called him that morning with news that should have been hopeful. His rare O-negative blood type made him a perfect kidney donor match for Maya Caldwell, the 24-year-old daughter of Lillian Caldwell, CEO of the pharmaceutical giant, where Eliot mopped floors and emptied trash cans. But hope had curdled into suspicion the moment Lillian Caldwell herself appeared in the consultation room, her silver hair pulled into a severe bun, her expensive suit a stark contrast to Eliot's worn work clothes. "Mr. Hayes," she'd said, her voice smooth as polished steel, "I understand you're willing to help my daughter." Eliot had nodded, thinking of 12-year-old Noah at home, struggling with another asthma attack while their insurance claim sat in limbo. The overtime pay from his night shifts at Caldwell Pharmaceuticals barely covered their rent, let alone Noah's mounting medical bills. If helping this woman's daughter could somehow improve their situation, he'd do it. Of course, there are certain protocols, Lillian continued, sliding a thick document across the table. Standard procedures for organ donation involving company employees. Eliot had skimmed the first page, his heart sinking with each legal clause. Non-disclosure agreement. Confidentiality restrictions. Penalties for breach of contract that would bankrupt him 10 times over. "You want me to sign away my right to talk about this?" he'd asked. "It's for everyone's protection," Lillian replied. "Medical privacy is paramount. Surely you understand." But Eliot didn't understand. Why would saving someone's life require legal muzzling? Why did the woman who paid his meager salary need protection from him? Now, alone in the waiting room, he read the document more carefully. The NDA wasn't just about medical privacy. It covered any and all interactions, communications, or observations related to Caldwell Pharmaceuticals, its employees, executives, or associated parties. It would silence him completely about anything involving the company. His phone buzzed with a text from Noah. "Dad, can't find my inhaler. Chest feels tight." Panic shot through Eliot's chest. Noah's backup inhaler was empty, and they couldn't afford a replacement until next week's paycheck. The irony wasn't lost on him. Here he sat, about to donate an organ to save one person's child, while his own son gasped for breath at home. "Mr. Hayes." Dr. Martinez appeared in the doorway. "We need your decision. Maya's condition is deteriorating rapidly." Eliot looked up at the doctor, then back at the contract. Every instinct screamed danger, but Noah's text message burned in his mind. If he walked away now, would there be other opportunities? Would Lillian Caldwell remember his refusal when it came time for layoffs or insurance decisions? "The surgery itself," Eliot said slowly. "What are the risks?" "Minimal for a healthy donor like yourself," Dr. Martinez assured him. "Standard laparoscopic procedure. You'd be back to light work in 2 weeks. And if something goes wrong..." "Mr. Hayes, I won't lie to you. There are always risks. But statistically, I'm not asking about statistics," Eliot interrupted. "I'm asking what happens to my son if I don't make it off that table." Dr. Martinez's expression softened. "You're a single father?" "Noah's all I have. And I'm all he has." The doctor glanced toward where Lillian had disappeared, then leaned closer. "Between us, this NDA is unusual. I've never seen anything like it for a straightforward donation." Eliot's suspicions crystallized into certainty. Something was wrong here. But Noah needed his medication, needed stability, needed a father who could provide for him. And Lillian Caldwell held all the cards that he signed his name on the line, feeling like he was signing away more than just his right to speak. The contract disappeared into Lillian's briefcase within minutes, as if she'd been watching from the shadows. "Excellent choice, Mr. Hayes," she said, her smile cold and calculated. "I assure you, your sacrifice won't go unrecognized." But as Eliot prepared for pre-surgical testing, her words felt less like a promise and more like a threat. He'd stepped into something bigger than organ donation, something that made his hands shake worse than the fluorescent lights overhead made his eyes water. The trap had been set, and he'd walked right into it. The surgery had been a success, but recovery felt like punishment. 3 weeks later, Eliot's incision still ached as he sat across from Lillian Caldwell in her corner office on the 40th floor of the Caldwell Pharmaceuticals Tower. Through floor-to-ceiling windows, Chicago's skyline stretched endlessly, a view worth more than Eliot would earn in a lifetime. "Maya is doing remarkably well," Lillian said, not bothering to look up from her tablet. "The transplant took beautifully. Dr. Martinez says she'll make a full recovery." Eliot shifted in the leather chair, trying to find a position that didn't pull at his healing wound. "That's good to hear. Which brings us to your future here at Caldwell." Lillian finally looked at him, her gaze sharp and calculating. "I believe in rewarding loyalty, Mr. Hayes. Your sacrifice deserves recognition." The word sacrifice sounded wrong in her mouth, clinical and cold. "I appreciate that, ma'am, but I just want to get back to work." "No one needs." "Yes, your son's medical situation. Asthma, correct?" She consulted her tablet again. "Quite severe, from what I understand. Expensive to manage." Eliot's blood chilled. How did she know details about Noah's condition? "I'm prepared to offer you a permanent position," Lillian continued. "Full-time facilities maintenance supervisor. Steady hours, predictable schedule. Most importantly, access to our employee health plan." The offer should have felt like salvation. Instead, it felt like a noose tightening around his neck. "The salary would be $35,000 annually," she added, "plus benefits." Eliot did quick math in his head. It was barely more than he made cobbling together part-time shifts, certainly not enough to escape their crumbling South Side apartment. But the health insurance would cover Noah's medications, his doctor visits, maybe even the specialist Dr. Kim had recommended. "What would my responsibilities include?" "Standard maintenance duties, cleaning laboratories, monitoring equipment, ensuring our facilities meet regulatory standards." Her smile was razor-thin. "Nothing too demanding for someone in your condition." The emphasis on condition wasn't lost on him. She was reminding him that he was now damaged goods, a man with one kidney who owed his livelihood to her generosity. "There is one additional requirement," Lillian continued, sliding another document across her desk. "Given your access to sensitive areas, you'll need to sign this supplementary confidentiality agreement." Eliot scanned the new contract. It was even more restrictive than the first, binding him to report any unusual observations directly to management. It essentially made him a company spy, required to inform on his fellow workers. "I don't understand. Why would maintenance work require this level of secrecy?" "Caldwell Pharmaceuticals handles proprietary research, Mr. Hayes. Industrial espionage is a constant threat. Surely you can appreciate our need for security." The explanation sounded reasonable, but something about her tone suggested there was more to it. Eliot thought about Noah, currently staying with their elderly neighbor Mrs. Chun while he attended this meeting. The boy had woken up wheezing again that morning, and their insurance claim for his latest inhaler had been denied, pending additional review. "I accept," he said, because what choice did he have? "Excellent. You start Monday. Report to Building Supervisor Janet Murray at 6 a.m. As Eliot left her office, the elevator descended past floor after floor of gleaming laboratories and executive suites. He couldn't shake the feeling that he'd just signed another contract with the devil. His new job started with an orientation tour of facilities he'd only glimpsed during his part-time shifts. Janet Murray, a weathered woman in her 50s, led him through corridor after corridor of research labs. "Your main responsibility is maintaining cleanliness standards in the research wing," she explained as they walked. "These labs handle sensitive compounds. One contamination could ruin months of work." They stopped outside Lab 7, where researchers in hazmat suits worked with vials of clear liquid. Through the observation window, Eliot watched a technician carefully measure doses into rows of syringes. "What are they working on?" he asked. Janet's expression tightened. "That's not our concern. We clean, we maintain, we keep our eyes on our own work." But Eliot had always been observant. Over his first week, he noticed things that didn't seem right. Medical waste bins filled with animal testing materials, marked with project names like Breathe Easy Clinical Trial. Research notes carelessly, left on laboratory benches, documenting respiratory distress in test subjects. Phone conversations behind closed doors about acceptable casualty rates, and liability mitigation. The sterile tang of cleaning chemicals filled his nostrils as he mopped the laboratory floors each night. But underneath it, he detected something else, the scent of fear. Researchers who wouldn't meet his eyes when he entered their labs. Hushed conversations that stopped abruptly when he appeared. Meanwhile, Noah's condition seemed to be worsening despite the new insurance coverage. Dr. Kim had prescribed a new medication, ironically, one manufactured by Caldwell Pharmaceuticals, but it wasn't helping. If anything, Noah's attacks were becoming more frequent and severe. 2 floors above Eliot's workstation, Maya Caldwell was conducting her own investigation. Her recovery room adjoined her mother's executive conference room, separated by a thick glass wall that Lillian assumed was soundproof. It wasn't, at least not completely. Maya had started listening more carefully to her mother's conversations, initially out of boredom, then with growing alarm. Over the past week, she'd overheard fragments that painted an increasingly disturbing picture. Hayes signed the NDA, she'd heard her mother tell someone on a phone call. He won't be a problem going forward. The kidney was just the beginning, another voice had said during a board meeting. Now we have him exactly where we need him. Maya had pressed her ear closer to the glass, catching more pieces. His son's medical bills give us perpetual leverage. He'll do whatever we ask, no questions. The realization hit her like ice water. Her mother hadn't just found a donor, she'd manufactured one. Someone desperate enough to risk his life, vulnerable enough to be controlled afterward. Maya's investigation began in earnest. Using her access to company databases, she started piecing together Eliot Hayes' employment history. Hired originally as a part-time janitor. Multiple requests for overtime consistently denied. Health insurance applications repeatedly rejected. Due to pre-existing conditions, specifically, his son Noah's chronic asthma. Each rejection had pushed the family deeper into financial crisis. The pattern was clear. Lillian had kept Eliot Hayes desperate by design. But why would her mother go to such elaborate lengths to control one maintenance worker? Maya dug deeper. Accessing files she probably shouldn't have been able to see. Project Breathe Easy, a new asthma medication in clinical trials. Phase 2 results showing concerning side effects. FDA review pending. But with troubling data being systematically suppressed, her blood ran cold as she read the trial data. Children in the study had experienced severe respiratory distress. 6 had been hospitalized. 2 had died. The drug was supposed to treat asthma, but in nearly 30% of cases, it made symptoms dramatically worse. And Caldwell Pharmaceuticals was pushing for fast-track approval anyway. Maya cross-referenced the trial locations with employee addresses. Eliot Hayes lived 6 blocks from the primary testing site. His son Noah was exactly the demographic they were targeting, children with moderate to severe asthma, from low-income families who couldn't afford premium healthcare. What would you do if you discovered your family's company was hiding deadly side effects? Share your thoughts in the comments below. The conference room door opened, and Maya quickly minimized her browser windows. Dr. Martinez entered, followed by her mother, and 2 board members Maya didn't recognize. "How are you feeling today, Maya?" the doctor asked. "Better. Stronger." Maya forced a smile. "Dr. Martinez, I'd like to ask you about my donor." Lillian stiffened almost imperceptibly. "What would you like to know?" Dr. Martinez asked cautiously. "Just, how did you find such a perfect match so quickly? I know how rare my blood type is." The doctor glanced at Lillian, who gave an almost invisible shake of her head. "We were fortunate," he said carefully. "Sometimes these things align." Was he tested recently? For the company's employee wellness program, perhaps. The silence stretched too long. Maya saw her mother's jaw clench, saw the board members exchange worried glances. "Maya, these details aren't important," Lillian said smoothly. "What matters is that you're healthy." But Maya pressed on, her voice steady despite her racing heart. "I've been thinking about our employee insurance policies. Don't we typically exclude pre-existing conditions for part-time workers?" Maya, so, if someone's child had a chronic condition like asthma, they'd essentially be trapped working for us. Too poor to afford private insurance, too sick to risk losing their job, too desperate to refuse when we asked them to do something dangerous, like donate an organ. Dr. Martinez looked profoundly uncomfortable. The board members had gone pale. Lillian's expression had turned glacial. "What exactly are you suggesting?" Lillian asked, her voice deadly quiet. Maya met her mother's gaze directly, drawing strength from her new kidney, from Eliot Hayes' sacrifice. I'm suggesting that maybe my donor didn't volunteer out of altruism. Maybe he was coerced by someone who systematically destroyed his financial security, then dangled his child's health as leverage. The sterile tang of cleaning chemicals drifted through the air conditioning system, a reminder of the laborers who kept Caldwell Pharmaceuticals gleaming while earning poverty wages. Maya had never noticed that smell before her transplant. Now, it seemed to permeate everything. That's a serious accusation, Lillian said. Yes, it is. Maya's voice was growing stronger with each word. And I think it's true. I think you've been planning this for months, maybe years, keeping Eliot Hayes poor and desperate until you needed something from him. One of the board members started to speak, but Lillian silenced him with a look. You're upset, Lillian said to Maya. The medication, the stress of recovery, it's affecting your judgment. My judgment is fine, Mother. It's my conscience that's finally working. That evening, Maya received a text from an unknown number. Your mother is destroying lives. Meet me if you want to know how many. The message included an address, a diner, on the south side, in the same neighborhood where Eliot Hayes lived with his son. Maya stared at the message, then at the Project Breathe Easy file still open on her laptop. Children were dying because of drugs her family's company was pushing through approval, and the man who'd saved her life was being used as a pawn in that deadly game. For the first time since her transplant, Maya felt truly alive. Not because of her new kidney, but because she finally had a purpose worth the life she'd been given. She grabbed her coat and headed for the elevator. It was time to meet her donor face to face. Whether her mother approved or not, 3 months into his new position, Eliot discovered that loyalty to Lillian Caldwell came with a price he wasn't prepared to pay. The summons came on a Friday afternoon. A terse email directing him to report to the executive floor immediately. When the elevator doors opened, Lillian was waiting with 2 men in expensive suits. Corporate lawyers, by the look of them. Mr. Hayes, thank you for joining us. Lillian's smile was cold professional courtesy. We have a situation that requires your particular expertise. They led him to a conference room overlooking the city. On the table sat a stack of maintenance logs, his maintenance logs from the past month. There's been a problem with our record keeping, one of the lawyers said. Specifically, the cleaning schedules for Laboratory 7. Eliot's stomach dropped. Lab 7 was where they conducted the Breathe Easy trials, where he'd witnessed the troubling research firsthand. I don't understand, he said carefully. Lillian activated a large monitor on the wall. Security footage appeared, showing Eliot entering Lab 7 at various times over the past weeks. Timestamps showed him accessing the facility outside his scheduled cleaning windows. You've been in that laboratory when you weren't supposed to be, Lillian said. Your keycard logs confirm it. I was doing my job. Sometimes spills happen, contamination alerts go off. Yes, but there's no record of these incidents in your reports. The second lawyer opened a folder. According to your logs, you've never encountered any irregularities in Lab 7. No spills, no contamination, no unusual observations. Eliot realized where this was heading. What do you want from me? Simple correction of an oversight, Lillian said. Your logs need to reflect that Lab 7 has been consistently clean and compliant. No irregularities, no incidents, no concerns whatsoever. But that's not true. You've seen what you were supposed to see. A laboratory conducting legitimate pharmaceutical research. Lillian's voice carried a subtle threat. Nothing more. Eliot looked at the falsified logs they wanted him to sign. Clean, sanitized records that would hide months of problematic trials. His signature would make him complicit in covering up evidence that could endanger lives. I can't sign this. The room fell silent. Lillian exchanged glances with her lawyers. Mr. Hayes, I think you're forgetting something important. She pulled out another folder, thicker than the first. Your son's medical records. Eliot's blood turned cold as she spread Noah's charts across the table. Emergency room visits, specialist, appointments, prescription records. His entire medical history laid bare. Noah's condition has worsened significantly over the past month, Lillian observed. 3 emergency room visits. 2 hospitalizations. The new medication isn't working, is it? How do you have access to his medical files? We're his insurance provider, Mr. Hayes. Of course we have access. Her smile was predatory. The question is whether we continue to be his insurance provider. The threat was crystal clear. Sign the false reports, or lose Noah's health coverage. There's also the matter of your employment status, one of the lawyers added. Falsifying company records is grounds for immediate termination. Criminal charges could follow. But you're asking me to falsify records. We're asking you to correct an oversight, Lillian corrected. Your logs should reflect the pristine condition of our facilities. Nothing irregular, nothing concerning, nothing that might be misinterpreted by outside parties. Eliot stared at the documents, his hands shaking. Noah needed those medications. Without insurance, they couldn't afford his inhalers, his doctor visits, his emergency treatments. But signing these logs would help cover up a drug trial that was harming children like Noah. I need time to think. You have until Monday morning, Lillian said. Sign the corrected logs, or we'll be forced to pursue other options. That evening, Eliot sat at their kitchen table long past midnight, staring at Noah's latest prescription bottles. The boy was sleeping fitfully in the next room, his breathing labored even with the nebulizer running. The new Caldwell medication was supposed to help, but Noah seemed worse than ever. His phone buzzed with a text from Maya Caldwell. We need to talk. Southside Diner, tomorrow 2 p.m. Come alone. Eliot deleted the message immediately. Whatever game the CEO's daughter was playing, he couldn't afford to be part of it. Not with Noah's health hanging in the balance. Just after 1 in the morning, Noah's coughing woke Eliot from restless sleep. The boy was sitting up in bed, gasping for air, his lips tinged blue around the edges. Dad, Noah wheezed. Can't breathe. Eliot grabbed the emergency inhaler, but it was empty. The backup inhaler produced only a weak puff before running dry. Noah's breathing grew more desperate. Hold on, buddy. We're going to the hospital. The drive to Chicago General felt endless, Noah's labored breathing filling the car. By the time they reached the emergency room, the antiseptic smell hit Eliot like a physical blow, sharpening his desperation as he watched nurses hook Noah up to oxygen monitors. The familiar chemical tang brought back memories of his surgery, of signing away his rights, of the trap he'd walked into. Is he going to be okay? Eliot asked Dr. Patel, the attending physician. His oxygen levels are dangerously low. We're starting him on high-dose bronchodilators. The doctor frowned at Noah's chart. This is his 3rd visit this month. The medication he's on should be helping. It's not working. If anything, he's getting worse. Dr. Patel pulled Eliot aside. Has Noah been exposed to any new environmental factors? Different foods, new cleaning products, anything that might trigger increased symptoms. Eliot thought about the Caldwell laboratories, the chemical smells. He brought home on his clothes despite changing at work. I don't think so. Mr. Hayes, I need to ask, have you considered getting a second opinion? There are specialists who might be able to help. Our insurance only covers certain doctors. I understand, but Noah's case is becoming concerning. These aren't typical asthma patterns. As Dr. Patel returned to his rounds, Eliot noticed Noah was awake and listening. The boy's eyes were sharp despite his breathing difficulties. Dad, Noah whispered. The medicine isn't helping because it's making me sick. What do you mean? I looked it up online. Other kids are getting sicker too. There are forums where parents talk about it. Eliot felt a chill that had nothing to do with the hospital air conditioning. Noah, you need to rest. Dad, I know you work for the company that makes my medicine, and I know you're scared. Before Eliot could respond, Noah's breathing became labored again. The monitors started beeping as his oxygen levels dropped. By morning, Noah was stable but still on oxygen when Lillian Caldwell appeared in the hospital corridor. She wore casual clothes, designer jeans, and a silk blouse, but her presence felt as threatening as ever. I heard about Noah's emergency admission, she said. I wanted to check on him personally. How did you know we were here? Insurance notifications. Mr. Hayes, I take a personal interest in our employees' welfare. They stood outside Noah's room, watching through the glass as the boy rested fitfully. This could all be avoided, you know, Lillian said quietly. Sign the maintenance logs, and I can arrange for Noah to see the best specialists. Experimental treatments, cutting-edge therapies. Money would be no object. And if I don't sign, then I'm afraid Noah's condition might be reclassified as a pre-existing condition that our policy doesn't fully cover. These emergency visits are Expensive, Mr. Hayes. Without insurance, you'd be looking at bankruptcy. Eliot watched his son struggle to breathe and felt something break inside him. Lillian Caldwell had orchestrated everything: his financial desperation, the organ donation, even Noah's worsening condition. They were trapped in a web she'd been spinning for years. "I'll sign your logs," he said finally. "Excellent. I'll have them messengered over this afternoon." As Lillian walked away, Eliot didn't notice that Noah was awake and had been listening. Through the thin hospital room door, the boy had heard everything, and his phone, hidden under his blanket, had been recording the entire conversation, but the stress of eavesdropping triggered another attack. Noah's breathing became ragged, then stopped altogether. Alarms shrieked as his oxygen levels plummeted. Eliot rushed into the room as medical staff swarmed around his son's bed, the antiseptic smell now mixed with the metallic scent of fear. Noah's phone slipped from his unconscious fingers, the recording still running as doctors fought to save his life. The evidence that could expose Lillian Caldwell lay inches from Eliot's feet. But all he could see was his son's motionless form surrounded by machines that might not be enough to bring him back. Noah survived the night, but barely. When he finally opened his eyes the next morning, his first words weren't about his breathing or his pain. "Dad?" he croaked, pointing weakly at his phone on the bedside table. "Listen." Eliot picked up the device, confused. The screen showed a recording that had been running for over 12 hours. His heart stopped as he realized what Noah had captured: every word of Lillian's threat, her admission of using Noah's medical needs as leverage, her demand that Eliot falsify safety records. "You recorded all of this?" Noah nodded weakly. "She's the reason I'm sick, isn't she? The medicine from her company is making me worse." Before Eliot could answer, Dr. Anand appeared in the doorway. The surgeon who had performed Maya's transplant looked troubled as she reviewed Noah's latest test results. "Mr. Hayes, I need to speak with you privately." They stepped into the hallway, where Dr. Anand's expression was grim. "Noah's blood work shows something concerning. Elevated levels of compounds that shouldn't be in an asthma medication. I've seen similar patterns in other children recently, all using the same Caldwell pharmaceutical. You think the medication is causing his symptoms? I think it's making them significantly worse. This isn't medical malpractice, Mr. Hayes. This is deliberate harm." Eliot's hands shook as he showed her Noah's recording. Dr. Anand listened in stunned silence, her face growing paler with each revelation. "This woman forced you to donate your kidney, then used your son's illness to control you. She's demanding. I falsify maintenance logs to hide evidence about the drug trials. Children are getting sicker, and she wants me to help cover it up." Dr. Anand was quiet for a long moment, staring through the hospital window at the Caldwell Pharmaceuticals tower dominating the skyline. "There's someone you need to meet," she said finally. "Maya Caldwell has been trying to reach you. She's not like her mother." Later that afternoon, Maya arrived at the hospital with dark circles under her eyes and a determination that reminded Eliot of Noah when he'd made up his mind about something. "Mr. Hayes, I owe you more than my life," she said. Without preamble, "I owe you the truth." She sat beside Noah's bed as the boy listened with wide eyes, explaining how she discovered her mother's manipulation, the dangerous drug trials, the systematic exploitation of desperate families. "Your mother turned your kidney donation into a weapon against us," Eliot said. "I know, and I'm going to stop her." Maya's voice was steady with resolve. "But I need that recording." Eliot hesitated. The recording was their only leverage, their only proof of Lillian's crimes. "What are you planning to do? Give it to someone who can use it?" Dr. Anand has contacts at the FDA, at medical journals, at news organizations that specialize in pharmaceutical corruption. Dr. Anand nodded. "There's an investigative journalist named Marcus Webb who's been tracking Caldwell's trial irregularities for months. This recording would give him everything he needs." Noah spoke up from his hospital bed, his voice still weak, but determined. "Do it, Dad. She can't keep hurting kids like this." That evening, Marcus Webb's story broke across every major news platform. The leaked recording of Lillian Caldwell threatening a kidney donor's sick child while demanding falsified safety records sent shockwaves through the pharmaceutical industry. Social media exploded with outrage as parents shared stories of children who'd gotten sicker after starting Caldwell's asthma medication. The by midnight, Caldwell Pharmaceutical stock had dropped 40%. By morning, protesters surrounded The corporate headquarters. Lillian's downfall was swift and absolute. Faced with criminal investigations, class action lawsuits, and a board of directors terrified for their own futures, she had no choice but to resign in disgrace. Maya was appointed interim CEO on an emergency basis, the only family member with clean hands and the trust of the remaining board members. Her first act was to halt all Breathe Easy trials and issue a voluntary recall of the medication. Her second was to arrange a meeting with Eliot at the hospital. "I can't give you back your kidney," she said, standing beside Noah's bed as the boy breathed easily for the first time in months after switching to a different medication. "But I can give you something else." She placed a thick legal document on the bedside table. Caldwell Medical Research Division. It's worth approximately $50 million. Laboratories, equipment, patents, research staff. As of this morning, it belongs to you. Eliot stared at the transfer papers, unable to process what he was seeing. "I don't understand. My mother built that division to develop drugs that would create lifelong patients instead of curing diseases, profitable customers instead of healthy people." Maya's voice was thick with emotion. "I want you to use it for the opposite purpose. Make medications that actually heal children like Noah." "Maya, I'm a maintenance worker. I don't know anything about running a pharmaceutical company. You know what it feels like to watch your child suffer while corporations profit from that suffering? That's the most important qualification there is." Dr. Anand stepped forward. "I've been offered the position of Chief Medical Officer if you'll accept the role of CEO. Together, we can transform that research division into something that actually helps families instead of exploiting them." Eliot looked at Noah, who was sitting up in bed with more energy than he'd shown in months. "What do you think, buddy?" "I think you should do it, Dad, so other kids don't have to go through what I went through." For the first time in his adult life, Eliot felt the weight of true choice. Not desperation forcing his hand, not threats constraining his options, but genuine power to determine his own path. "I accept," he said quietly. "This is what happens when ordinary people refuse to stay silent against corporate greed." Hit that subscribe button if you believe one person can make a difference. 6 weeks later, Eliot stood in the executive office of what was now called Hayes Medical Research, watching the Chicago skyline glow through floor-to-ceiling windows as the sun set behind the city's towers. The Caldwell Pharmaceuticals building was dark, its operations suspended pending federal investigation. Noah sat at a child-sized desk in the corner, working on homework while breathing easily. The new medication from a competing company had eliminated his symptoms within days of stopping the Caldwell drug. "Dad, look at this," Noah said, holding up a tablet showing news coverage of their story. "They're calling you a hero." Eliot didn't feel like a hero. He felt like a man who'd been pushed too far and finally pushed back. Dr. Anand entered with their first research proposal, a study to develop truly effective asthma treatments with no harmful side effects. Their laboratory would focus on medications that cured rather than created dependency. "The team is excited," she reported. "For the first time in years, they'll be working to actually help patients instead of generating revenue streams." Maya appeared in the doorway, no longer the pale, recovering transplant patient, but a woman transformed by purpose. "The federal investigation is expanding," she said. "They found evidence of similar manipulation at 3 other pharmaceutical companies. Your recording didn't just bring down my mother. It started a nationwide investigation." As the 3 adults planned their research priorities, Noah continued his homework, occasionally looking up at his father with pride. The boy who'd secretly recorded evidence of corporate corruption was now healthy enough to think about his own future, perhaps as a doctor, perhaps as someone who'd fight for other kids the way his father had fought for him. The Chicago skyline glittered with lights from thousands of windows, each one representing families who might never know how close they'd come to being victims of pharmaceutical greed. But in this office, bathed in the warm glow of city lights, a former maintenance worker was using his new power to ensure that corporate criminals could never again turn children's illnesses into profit centers. Eliot Hayes had gone from victim to victor, not through violence or revenge, but by refusing to let his son become another casualty of unchecked corporate power. The kidney he donated to save one life had somehow given him the tools to save thousands more. For the first time since Noah's birth, Eliot felt like he was in control of their destiny, not reacting to crises, not scrambling to survive, but actively building a future where families like theirs would never again be exploited by those who saw human suffering as a business opportunity. The recording that had started it all was now evidence in multiple criminal cases. But more importantly, it had become the foundation for something entirely new. A pharmaceutical company that put patients before profits, healing before wealth, hope before greed. 1 year later, Eliot stood before a packed auditorium at the University of Chicago, addressing a crowd of medical students, researchers, and patient advocates. The transformation of Hayes Medical Research from profit-driven corporation to patient-focused nonprofit had become a national model for ethical pharmaceutical development. "When I donated my kidney to save Maya Caldwell's life," he said, his voice carrying across the silent hall, "I thought I was making a simple choice between helping someone or walking away. I had no idea I was stepping into a battle for the soul of American healthcare." In the front row, Noah sat with Maya and Dr. Anand, his face glowing with health and pride. At 13, he'd become something of a celebrity among patient advocacy groups, the boy whose secret recording had exposed pharmaceutical corruption and sparked nationwide reform. The applause was thunderous as Eliot concluded his speech, but the real victory wasn't in the recognition, it was in the results. Hayes Medical Research had developed 3 breakthrough treatments in the past year, all available at cost to families regardless of their insurance status. Their asthma medication had replaced the dangerous Caldwell drug for thousands of children, with 0 harmful side effects reported. After the event, they drove home to their new apartment, not luxurious, but clean and safe, with Noah's own room and medical equipment that worked. As they climbed the stairs, Noah's energetic laughter filled the space, echoing off the walls as he raced ahead to show his father something on his computer. "Dad, look at this." Noah pulled up a news article on his laptop. The judge sentenced Lillian Caldwell to 15 years in federal prison. And look, they're ordering Caldwell Pharmaceuticals to pay $2 billion in damages to families affected by their fake drug trials. Eliot read over his son's shoulder, feeling a complex mix of emotions. Lillian's conviction had been inevitable once investigators discovered the full scope of her crimes, but seeing her in handcuffs still felt surreal. "She destroyed so many lives," Noah continued. "But now all those families are getting help." The settlement money was being distributed through a fund that Eliot helped administer, ensuring that children who'd been harmed by Caldwell's drugs received proper medical care and compensation. Many of their parents had become advocates themselves, turning their trauma into a movement for pharmaceutical transparency. Maya appeared in their doorway, carrying takeout bags from their favorite Thai restaurant. Since stepping down as Caldwell's CEO after overseeing the company's dissolution, she'd thrown herself into patient advocacy work, using her business expertise to help other families navigate the healthcare system. "Any word from Dr. Anand about the FDA approval?" she asked, setting food containers on their small dining table. "Approved," Eliot said, unable to suppress his smile. "Our new diabetes medication will be available next month. And the cancer research is ahead of schedule." Noah cheered, pumping his fist in the air. At 13, he understood better than most adults how rare it was for medications to be developed with patient welfare as the primary goal rather than an afterthought. They ate dinner discussing their latest projects, a collaboration with Chicago's children's hospitals to provide free medications to uninsured families, a research partnership with several universities to develop treatments for rare diseases that big pharmaceutical companies ignored because they weren't profitable enough. "Dad," Noah said as they cleaned up, "remember when you were scared to sign that NDA at the hospital?" "I remember. What would you tell yourself now, if you could go back to that moment?" Eliot considered the question seriously. "I tell myself that sometimes the scariest choices lead to the most important victories, and that you don't have to be powerful to make a difference. You just have to be willing to do what's right, even when it costs you everything. Even your kidney. Especially my kidney. That organ saved Maya's life, but more importantly, it connected us to a fight that was bigger than any of us realized." Maya smiled from the kitchen. "Your father's kidney didn't just save my life, Noah. It saved my soul. Before that transplant, I was sleepwalking through life, letting my mother's company hurt people while I looked the other way. The guilt of receiving that gift from someone my family was exploiting, it woke me up." Later that evening, As Maya headed home and Noah settled in with homework, Eliot received a call from Marcus Webb, the journalist whose investigation had exposed Caldwell's crimes. Eliot, I wanted to give you a heads up. The documentary about your story is being picked up by Netflix. They're calling it The Kidney Files. Should be released next month. Will it help other families? That's the goal. We're hoping it encourages more whistleblowers to come forward and shows families that they don't have to accept corporate abuse just because they're poor or desperate. After the call, Eliot sat in his living room, listening to Noah's gentle breathing from the next room. Gone were the labored gasps, the middle-of-the-night emergency inhaler searches, the terrifying rush to the hospital. His son slept peacefully, his lungs clear and strong. The transformation felt almost impossible to believe. A year ago, they'd been trapped in a cycle of poverty and illness, controlled by a woman who saw their desperation as a tool for her own purposes. Now, Eliot ran a multi-million-dollar research organization dedicated to helping families exactly like they'd been. His phone buzzed with messages from other parents whose children had been harmed by pharmaceutical companies. Some seeking advice, others sharing their own stories of fighting corporate giants. The movement that had started with Noah's secret recording had grown into a nationwide network of families demanding accountability from the medical industry. Noah appeared in the hallway, rubbing his eyes sleepily. Dad, I can't sleep. I keep thinking about all the kids who are going to get better because of the medicines we're making. That keeps you awake. In a good way. Like, excited awake, not scared awake. Eliot pulled his son into a hug, marveling at how different this felt from the desperate embraces of a year ago when Noah was struggling to breathe. You know what I'm most proud of? Eliot said. Not the company, not the money, not even stopping Lillian Caldwell. I'm most proud that you learned something important, that ordinary people can fight back against injustice and win. Even kids, especially kids. You recorded the evidence that brought down one of the most powerful women in Chicago. You helped save thousands of other children. That's not ordinary, Noah. That's extraordinary. As they stood together in their small apartment, father and son who'd survived corporate predation and emerged stronger, Eliot felt the final piece of his emotional journey click into place. The fear that had driven him to sign that first NDA was gone. The anger that had consumed him during Lillian's manipulation had transformed into purpose. The desperate resolve that had carried him through Noah's crisis had evolved into sustainable determination. Now, finally, came vindication, not revenge, but the deep satisfaction of knowing that his sacrifice had created something larger than their personal victory. Across the country, families were safer because he'd refused to stay silent. Children were healthier because he'd chosen truth over security. Noah's laughter drifted through the apartment once more as he shared a funny video on his phone, the sound rich and full of life. It was the sound of a future that almost didn't exist, saved by a father's love and a son's courage. If this story moved you, subscribe and hit the bell for more inspiring tales of ordinary people who refused to let the powerful crush their hope. Join our community of families fighting for justice, because together, we're stronger than any corporation.